New on Daybreak, advocating for change. Indiana families are raising awareness about bleeding disorders and hoping to get lawmakers' attention. News 8's Aaliyah Hodges is live in Indianapolis. Aaliyah, explain a Fortville family there getting involved.
Yes, the family, Kimber Blackwell and her 14-year-old daughter, Kate, they are raising awareness as March is National Bleeding Disorders Awareness Month. And so the definition of a bleeding disorder is when the blood does not clot properly. So the two took part in a virtual event called Washington Days, hosted by the National Hemophilia Foundation. They hope to increase funding in bleeding disorder research and improve access to care. Both Kimber and her 14-year-old daughter have von Willebrand disease, or VWD. It's one of the most common and yet underdiagnosed inherited bleeding conditions. Kimber is a physician assistant at the Indiana Hemophilia and Thrombosis Center in Indianapolis. She'd worked with patients with rare bleeding disorders for years until she realized that her symptoms matched those of VWD. And her daughter, Kate, was diagnosed when she was only in kindergarten after a volleyball to the face and a nosebleed that wouldn't stop.
I think it's just important to share your story, especially when you have a medical condition that's not common, that it really just gives a face and a personal story and a personal touch to lawmakers to be able to see how having a bleeding disorder impacts everyday life.
The most common symptoms of von Willebrand disease include frequent nosebleeds, abnormal or easy bruising, excessive bleeding of the gums, bleeding after minor injury and bleeding after surgery, gastrointestinal bleeding, heavy menstrual bleeding, and bleeding after childbirth. The Indiana Hemophilia and Thrombosis Center says more than 60,000 people in Indiana are living with a rare bleeding disorder, and some of them don't even know it. For now reporting, I'm Aaliyah Hodges for WishTV, WishTV.com, and follow us on Facebook.